The rule of clinical pharmacy is simple. Treat the patient, not the isolated lab data. We use lab values strictly to confirm efficacy, calculate precise dose adjustments, and prevent toxicity. When dealing with a case of febrile neutropenia, passive observation is simply not an option. This is an absolute medical emergency. Looking at this protocol, the critical dual threshold is clear: an absolute neutrophil count below 500, combined with a fever of 38.3 degrees Celsius or higher. Hitting this mark mandates the immediate initiation of broad-spectrum antibiotics. In these specific hematological crises, supportive care or simple monitoring will fail. Rapid intervention is the only way to prevent fatal outcomes. This chart outlines the strict 3-step mandatory protocol for unfractionated IV heparin. If the APTT exceeds 100 seconds, you must immediately hold the infusion, confirm the result, and notify the prescriber. Anticoagulation targets vary heavily by diagnosis. As highlighted here, a mechanical mitral valve replacement demands a strict, elevated INR target of 2.5 to 3.5, completely distinct from standard atrial fibrillation parameters. Maintaining this narrow window is critical. Deviating above 3.5 creates an immediate bleeding risk, while dropping below 2.0 leaves the patient vulnerable to thrombosis. This summary rule illustrates how to read the liver story using the AST to ALT ratio. A ratio greater than 1 points towards alcoholic liver damage or cirrhosis, while ALT exceeding AST indicates viral hepatitis or fatty liver disease. Moving to renal function, this diagram highlights an absolute rule. Blood urea nitrogen and creatinine must always be evaluated together to determine the true root cause of organ distress. The 3 distinct outcomes are clear. Concurrent highs indicate kidney failure. A high BUN with normal creatinine points to dehydration or a GI bleed. But a low BUN with normal creatinine indicates liver failure because the liver can no longer synthesize urea. Relying on isolated renal or hepatic markers is dangerously misleading. Accurate diagnosis requires reading these paired metrics in context. This side-by-side comparison shows exactly why procalcitonin is the superior tool for antibiotic stewardship. Unlike C-reactive protein, which rises during any general inflammation, PCT spikes specifically in response to bacterial infections. Pay attention to the exam trap highlighted at the bottom. Procalcitonin has a half-life of roughly 24 hours, 1 full day, not 1 hour. Relying on the non-specific CRP often leads to unnecessary antibiotic prescriptions. PCT provides the precise data required to safely start and stop therapy. This calendar graphic details the rigid scheduling required for methotrexate. Dosing is strictly weekly, and any folic acid supplementation requires a mandatory 24-hour delay. Direct oral anticoagulants require aggressive monitoring. Rivaroxaban requires a dose reduction to 15 milligrams if creatinine clearance drops between 15 and 50. Below that, strong CYP3A4 inducers like carbamazepine will severely drop apixaban levels, creating a major bleeding emergency. This diagram illustrates how easily lithium toxicity is triggered. Simple dehydration concentrates the drug, while ACE inhibitors like lisinopril directly block renal clearance, rapidly inducing coarse tremors and slurred speech. With these high-risk medications, a pharmacist's proactive intervention on dosing schedules and inducer avoidance is the primary defense against life-threatening toxicity. Let's lock in the top takeaways. An ANC under 500 with a fever means emergency antibiotics. An APGT over 100 seconds on heparin means hold immediately, confirm, and notify. Always correct magnesium before potassium. An AST to ALT ratio over 1 points to alcoholic liver damage. And a fasting glucose of 100 to 125 indicates prediabetes. PCT guides antibiotics because it's bacterial specific. Mechanical mitral valves need an elevated INR of 2.5 to 3.5, and a low BUN with normal creatinine confirms liver failure. Mastering these exact thresholds allows you to act as a life-saving clinical steward. Test your knowledge right now.